It's really about connecting substance abuse and health.
This information's all confidential and voluntary.
I'm an attending physician in the emergency department. It became evident early on that we needed some help with substance use.
We can do something about this. We can prevent this. We can intervene early. SBIRT is an acronym which stands for Screening, Brief Intervention, and Referral to Treatment.
Having SBIRT in our primary care clinic started to just normalize the conversation.
It's decreasing the stigma, so I'm not just asking people with risky substance use questions about substance use. I'm asking everyone about their substance use behaviors to reduce risk at any level.
About how many days out of 30 do you think you've drank? As the SBIRT health educator, we do universal screening for all our patients here for substance use, tobacco, and alcohol use.
It's about talking to patients about how substance use may or may not be affecting their health and giving them some information and resources if they need it.
When a patient comes in for primary care, they get their vital signs, their weight, their blood pressure, all of that. And as part of that, the nurse or medical assistant will ask them the 5 SBIRT questions.
And then we have health educators that can do a more in-depth screening and actually give resources and do a motivational interviewing with patients.
The Colorado Office of the Governor, in conjunction with the Colorado Office of Behavioral Health, received 2 consecutive 5-year grants from SAMHSA, the Substance Abuse and Mental Health Services Administration, to implement SBIRT throughout the state.
Since the initiative began, we have been an evaluation partner for the initiative. So we work with the Office of Behavioral Health, we work with Peer Assistance Services, and all of the grant partners, the implementation sites to gather evaluation data, to understand what's working well, where can we improve, how can we best implement these services and achieve the health outcomes that we want.
Through this project, Peer Assistance Services provides technical assistance to communities and health professionals across the state to implement SBIRT.
I really think that it's brought together all the players in the state around the issue of substance use and how it affects health.
We are really fortunate to be a part of SBIRT in a rural part of Colorado because I think so often the focus is on more of the metro area and more of the populated places, but rural Colorado has a lot of needs. I think that's why SBIRT is so important because it really reaches folks that might not otherwise get those services.
I think it's really important to have a champion in the community for any cause, and I believe Peer Assistance Services is the best champion for SBIRT in Colorado.
It's where we can make the biggest difference in helping a person change their alcohol use.
The first time I think I heard a nurse or a resident say, "Is SBIRT here today?" I knew that we had made it.
I have loved the role that I've had as an SBIRT site supervisor. We take folks who are passionate about what they do and give them amazing training and amazing coaching and amazing support to just build on those skills.
There's a lot of thought out there from healthcare providers that patients might be resistant to talking about substance use.
What do you do if the patient you're speaking with does not feel that their alcohol use is risky?
What we learned from our follow-up interviews with random sample of patients who screen positive is that patients are actually very appreciative of being asked about their substance use.
We want them to understand that it's an important part of their health and there is a big connection with not just their physical health, but their overall well-being too. So SBIRT health educators, we really want to be there for the patient and we want to open the conversation, and it might be something the patient's already been thinking about, but no one's asked about.
On the ground, we can see that SBIRT is working. You know, the health educators see it when they see the patients come back that they've quit smoking or quit using or gotten into a program. You can tell it works when you see the patient.
Beyond what we've been able to do for patients, which has been a lot, getting to be a part of the grant has just really supported our entire clinic system in being on the forefront of behavioral health primary care integration. I don't think we could have done it without the grant.
There's a whole set of people out there who engage in risky patterns of use, and they don't necessarily know that those patterns are impacting their health. And if we just ask and have a conversation with patients, that can help us to reduce risky use and hopefully prevent that use from ever escalating into more severe issues where substance use, as we can see, can really have dramatic impacts on people's lives.
I think the future for screening brief intervention is bright.
Well, I would suggest that you try and quit for at least 3 months.
look at a variety of healthcare providers and various professions, whether it's nursing or medicine or pharmacy or the dental community, all of whom see an expanded role for them in this issue of substance use prevention.
If they include the screening data in their electronic records and they integrate it into their patient flow so it's a part of their everyday practice, we're much more likely to see screening and brief intervention become a standard of care in healthcare settings.
A major component of the SIM model, the State Innovation Model, is to integrate primary care and behavioral health into one community-based setting. And within that, we want to expand the implementation of SBIRT as well.
To continue the momentum, I think, of widespread adoption. And, part of it is teaching providers how easy it can be.
Seeing patients make that connection is pretty rewarding. I think that's definitely left an impact at Denver Health and in our community in general.
It makes me very proud of what we've developed. It's just priceless. I mean, what we could do for our community here that surrounds Denver Health. It's huge what we can do.